My name is Brooke and I work for USC's Joint Education Project. In this video, I'm going to be showing you how to make blood smears. In this unit on pathology, we learned about how doctors diagnose disease, and a blood smear can be used to diagnose diseases in the blood or anywhere else around the body. So, let's go ahead and get started. Before we get into our demonstration, I'm going to go through a short PowerPoint on blood smears, just so we get an idea of what they are, how they are related to pathology, and our unit of pathology. So the first question we want to ask is, what is pathology? The Merriam-Webster definition of pathology is that it is the study of the essential nature of diseases and especially of the structural and functional changes produced by them. So what does this mean? Pathology is the study of disease, and pathologists look for signs of disease at a microscopic level. So a pathologist creates a blood smear, which is a microscope slide with blood on it. They look at that blood underneath the microscope and diagnose diseases within the blood. So here's what a blood smear looks like and its relationship to pathology. Blood smears are microscope slides that are smeared with a patient's blood. And we can see those over there on the left or on the right-hand side. Blood kind of smeared across a microscope slide. A pathologist can look at this blood smear under a microscope to look for signs of disease in the blood. And a pathologist may use stains to make the blood smear easier to examine. So when they look at the blood, there are small cells. If you put a stain on that, it can highlight certain features of those cells, or it may highlight something that shouldn't belong there, maybe potentially a virus or other cells like cancer cells may show up looking different. So here's our pathologist on the left looking through her microscope and trying to figure out what's going on with a particular patient. And this is what she might see under that microscope. So we have three different potential blood smears. Our first one is showing signs of microangiopathic hemolytic anemia, and our second is showing autoimmune hemolytic anemia. Anemia is when your blood cells, they naturally are destroyed and recycled. But in this case, the rate that the blood cells are being destroyed is much faster than the rate that they are being produced. This means we're having lower levels of blood in the body, which is not good. These two are caused by very different reasons. One, the microangiopathic, and the other one, the autoimmune. And you can see the differences in those two pictures on how it looks. The one on the right is probably the most different. It is from sickle cell disease. So that is when the blood cell is not round and nice and has that nice divot in it. It can look like a sickle and it kind of a U shape. And so we can see some of those in that picture. So I think it's time for us to make our own blood smears. So let's go ahead and get started. So we have our supplies here. We have 3 slides. We are going to make 2 smears today. You really only need 2 slides to make 1 smear. We have our fake blood, which I have put into this little container here so it's easier to see, and a syringe to put small drops of blood, and then a paper towel just for cleanup. So you take this syringe, you put some of the fake blood in there, and then to make the smear, all we need is really just 1 drop. We'll put that there about in the center. When you pick up your slides, you'll notice that there is a rough side and then there's a smooth side. So you want to put both rough sides together because those are the front of the slide. And you just take it and you squish together and you want very light pressure and then even all the way across. And you have now made a smear. You can see that a little bit better when I put it down there. So we can do that again and we can actually reuse this slide. So I'm going to wipe that off and we will do it one more time. This one I'm going to put a little higher up just to get a longer smear. And again, putting both rough sides together, or the front sides of both. Press down, light pressure, even. Drag it across. And there we go. We have 2 great looking smears. And we're done. Thank you for watching this video on how to make blood smears. I hope you found this video helpful and you'll be making blood smears in your classroom soon. Bye.